Now, a positive COVID-19 test does not mean hospitalization for every patient.
That's right. Our Holly Emery talked to healthcare workers at Winston Medical Center about an antibody infusion that is keeping people out of their makeshift ICU.
I don't know that it kept me out of the hospital, but I'd rather not take that chance and find out.
Matt Woodward is an employee at Winston Medical Center in Louisville. After testing positive for COVID, he chose a new way of keeping symptoms from getting worse.
I feel like that the Regeneron helped decrease the severity of the symptoms. I went home and quarantined, and by Friday or Saturday, 2 or 3 days after receiving the treatment, I felt normal again.
Winston Medical has been offering patients monoclonal Regeneron antibody infusions, a medicine the director of nursing, Bert Turcott, has seen help COVID patients avoid harsh symptoms.
The vaccine is for the prevention, and the Regeneron is for the symptoms to be less and not need to be hospitalized. That patient can receive the Regeneron and then go home and probably have a good result from receiving that infusion.
Unlike the vaccine, patients need to test positive for COVID before they can receive the antibody treatment.
You can get it in an infusion, which is an IV, takes about 30 minutes, and then we watch you for an hour to make sure you don't have any reactions, or you can get it in 4 shots. And it takes just a couple of minutes, and then we do watch you again for an hour to make sure you don't have reactions.
According to registered nurse Natalie Willis, Winston County has been averaging 14 cases per day. However, more than half of those people choose to receive the infusion because of rising numbers of hospitalizations nationwide.
Once you actually have COVID, people usually feel pretty bad. And these injections, or the Regeneron is what we give a lot, that actually cuts down on the time that they're sick. And a lot of people have said they felt 100% better in just a couple of days after they received it.
In Louisville, Holly Emery, WCBI News.
Now, anyone either vaccinated or unvaccinated can get the antibody treatment if they test positive for COVID-19.